We're trained as physical therapists. We are licensed massage therapists. We fall back on the licensed massage therapist because it makes our scope of practice huge. One of the most remarkable outcomes I had, there was a gal that came in with fibromyalgia. She was in so much pain, she couldn't even stand her clothes touching her. She came in here in tears. She had had no sleep for 5 days. One treatment. She walked out pain-free. She was ecstatic. She slept like a baby that night and for the following weeks. And I occasionally see her just again, a ridiculously amazing positive outcome.
An amazing outcome we had with a Parkinson's disease, because the day I was trained, Bruce had a judge from New York in Clearwater, Florida, where we were taking the class, and we saw piece by piece taking the tremor off, lifting the spine, facing forward, still had a glazed eyes.
Glazed eyes.
And at the end of, he did not do that at the second. He waited times of the class to show the difference. When he finished treating this person, the judge could not believe it. He was amazing, walking from one side to the other. And what amazed me the most, he had these grayish eyes, very faded gray. When he got the last treatment, his eyes were bright blue. It's like he got life inside him. And he was walking and saying, "You don't understand how I feel. I feel amazing." He was alive. I mean, completely out of Parkinson. It's when you see things like this, you cannot treat everything that the person comes in. First thing is to throw MPS on them.
I had a client that had a gastric bypass. Her scars were very, very painful. So she came in for me to treat her scars. In the course of the input, I found out that she was a preemie. She was a toe walker. One of the things they did to her to try and stop her toe walking is they literally shredded one of her Achilles tendons. That Achilles tendon was so hard, it was like a wooden dowel. As part of her scar treatment, I offered to treat her Achilles tendon, and I said to her, "This is the first time I've treated an Achilles tendon. I know that I can't do any harm, and you may have an improvement." 10 minutes later, 95% decalcified, soft, pliable. You can only do good, positive things and that's one of the things that's nice about the modality. Okay, we've got a very unique story. I stumbled across a postcard for ETPS in 2009. I needed to do some continuing education, and the postcard made some very powerful claims. The training was going to be 2 miles from our studio. So I went initially to that training. Something very interesting happened. An hour into the training, one of the participants came up to the guy that was teaching the course and said, "I don't know that I'm going to be able to do this. I have pain on a scale of 9 to 10 for the past 4 years. I don't sleep at night." And the guy, I'm sorry, I don't remember his name. The guy teaching the class said, "Hey, that's why we're here. You can be the first client." he did the basic protocol. He hit hand points, and the guy, he was in so much pain. He had what we call a 1,000-mile stare. He had some improvement. I want to say 35 to 40%. He was ready to hop off the table. And the guy instructing the class said, no, this in no ways the outcome we're looking for. He said, do you have any scars? And the guy is a physical therapist, a practicing physical therapist. He said, I ruptured an Achilles tendon 4 years ago. So he started to treat the scar. You saw the look disappear on this guy's face. He literally came alive. He was impressed beyond belief. He didn't know what to say. So I was blown away. My wife at that time had a repetitive stress injury on her back. I had done a lot of massage techniques to give her some result. So I said, can I bring my wife in tomorrow as a patient? He's like, absolutely. So he did the same thing with Sandra, a basic protocol, hit, a couple of different points. And Sandra was at that point probably 60% pain-free. He asked the magic question, do you have any scars? Sandra had 4 C-sections. So he starts to treat her C-section. And as he treated her, she said, I can feel the pain falling away as you treat me.
Yes, my back went relaxed.
Unique that I'm in class and my first patient was my wife, and we were just this. These outcomes are sometimes miraculous.
Yes.
So Sandra got certified, and the next available point. Do you want to share what that was like for you?
It has been amazing with every client, but my most significant client that really made a remarkable outcome is she had a ruptured epicondyle, which is called tennis elbow.
But it was
and
ruptured.
It was ruptured. She was.
I'm sorry. It was torn.
Torn.
It wasn't a complete rupture.
So, if she would have surgery in 20 days, I said, let me treat you, because the surgery only works 70% of the time. So we treated her for 9 months. She never had to have an operation.
The surgery was canceled.
She completely healed from the arm. She canceled the surgery, and she lifts weights with us. She does pull-ups, push-ups, never had a problem again. It's magical in terms of tendinitis in any body part. Is amazing. It works.
She was 63 at the time. We do an extensive input form. And so we'll find out a lot of the issues before we even start. I explain to them, because we have people come in for massage and they want, increase in range of motion and decrease in pain. And I tell them, this is the first time you've experienced this. It releases serotonin, it releases endorphins, it calms the parasympathetic nervous system. If they're not sleeping well at night, I just say, you're going to have the most amazing sleep tonight. You'll get a right now benefit during the treatment. You'll get an enhanced benefit over the next 24 to 48 hours. So a lot of times when someone comes in for issues, we'll introduce them to the Dolphin. We always get an amazing outcome. Just the difference in the appearance of their face after we complete the first protocol. It's like they're relaxed. It's an aha moment.
The standard protocol relaxes the person there. Whatever pain they have that we have to use a different protocol, it's already minimized by the standard protocol. I do MLD massage, which is manual lymph drainage, and sometimes I use points at the hand to relax the person. So we use it all the time. We don't like to really treat fluffy massages. I don't. I do it, but I like to work with people that have problems because I know it's going to change their lives.
We had a young gal who's a Zumba instructor who was scheduled to teach a class. She came in locked up. She could not move her head independent of her body. Threw her on a table, did the standard protocol, hit a couple of points on the legs for the neck, opposite shin for opposite side of the neck. 15 minutes later, she was like an owl, just abnormal range of motion.
It's a funny thing because she was very modest. She had clothes all over her body. And she said, Scott asked her to open the back of her shirt. And she said, "You're going to treat my neck, not my back." So
she got another great outcome.
Yeah.
I absolutely love to treat Sandra because I know I'm doing something good for her. Sandra had hip issues for
3 years.
For 3 years.
He treated me for 3 consecutive years. I would not function if he would not have treated me. So the last day that I had my hip, that I went to the hospital, he could not treat me. That's the only day I had to use a walker.
To get into the hospital.
You know what is having osteoarthritis? There is no pain to cure that, but a hammer and a saw from the doctor. So there is no other way, but MPS alleviate. I could teach Zumba. I could dance with pain because he treated me in the morning, sometimes twice a day.
Every morning I treated her for 3 years. Every year she's teaching Zumba, physically active. Sandra's 72 today. She had her first hip replacement in January of 2017. Her second hip replacement in May of 2017. I had to strap her to a chair so that she wouldn't teach the classes.
It's amazing.
Yeah, really.
But when I treat him for back pain, he knows better that we have to treat the toes, and he's such a baby. He doesn't want me to go there. It hurts, right? So
the other thing I do with Sandra now is I'll treat just her hands. We don't like to say the A word, so we won't, but you have an indication of what I'm talking about. I'll literally do the golden triangle on the wrist, and then I'll hit points in the joints, and she's pain-free in 5 minutes.
And we have clients that work with hair. They use their hands because they are up on the head of the person, and they had the problem with the hands. So they come, and Scott, just before a Zumba class, he treats certain clients just to help their hands to free from the pain. And they are very thankful for that.
It's impacted our business. It's impacted our lives. It's impacted our relationship. When I can treat Sandra for 3 years to put off a hip replacement, that's very powerful.
I know.
Yeah.
It's not 3 days, it's 3 years.
3 years.
I did not know what I had. I thought it was muscle. And I would be improved with the MPS. Then I got to X-rays, and they are proof that bone on bone doesn't do any other thing but surgery,
I cannot believe with the results that we've gotten that every physical therapist, every massage therapist, anybody that's doing any kind of treatment, this is so effective. It's so simple. We treat migraine headaches. Someone will come in with a migraine headache. They've suffered for 8 hours. And I said, just step into my room for a second. I'll hit the points on the wrist and on the hand and on the foot. And 5 minutes later, I'll say, hey, how you doing with that migraine? And they're like, it's gone.
Yeah.
After,
Many times they come back to dance again. They were with a migraine before dancing. They come back and do a whole class.
So yeah, this modality, we're looking forward. Next week, we're going to get trained in VNS, vagal nerve stimulation. We're so excited about that. We're so excited that you guys have developed something that's a post-COVID treatment, something that addresses brain fog and so many other things. The vagal nerve is so complex. So we're very excited about that.